Hello everybody, Kylie Moss coming to you with an update from the International Society for the Study of Vulvovaginal Disorders World Meeting that we had last week. I did the update previously on the microbiome information that was given at the conference, and today I wanted to focus on lichen sclerosus, which is a skin condition a lot of my patients have that causes itching and scarring. So the big headline that I think was important and emphasized a lot of the conference was that there's a lot of information in the social media realm, but not all of it is accurate. There was a poster from Jacqueline Lanthier, who hosts an amazing blog and a lot of social media outreach for patients with lichen sclerosus that talked about this. And then Jennifer Foster, who's a medical student that works with Dr. Melissa Moskar, who's an incredible dermatologist at UT Southwestern, along with Jill Kraft, who's the Centers for Vulvovaginal Disorders social media and just general vulvar dermatology guru. They worked on a project looking at TikTok and how accurate the information was that's available on TikTok for patients. And they found that unfortunately 46% of videos had misinformation, meaning information that was not intended to be misleading but was inaccurate. They also found that 16% of the videos that they looked at had ties to commercial bias. So generally videos had poor information quality. They tend to be a better quality when they were coming from, unsurprisingly, healthcare professionals. But I think the big bummer was that they found that the videos that had commercial bias tended to be much more understandable for patients and tended to give them better action items. So the information that's most easily digested is more likely to be tied to things like supplements or companies that want people to think about their disease in a certain way so that they will buy a product. And that's really unfortunate. And I think it means that people need to be on social media giving accurate information. So that's why I'm here. I also wanted to give you a rundown on some of the therapies that are meant for patients who have failed traditional therapy for lichen sclerosus. In general, most patients will respond to steroids for lichen sclerosus that are applied topically, high potency, initially in sort of a burst or frequent application, and then less frequent application with time. But some patients don't respond. Patients can have a lot of thickening and scarring, and it can be hard to get the steroid down to the bottom layer of the skin where it's actually causing the disease. So for patients who aren't responding to sort of our traditional methods of applying steroids, there are a couple of, I think, good tips, some things that have better evidence than others. So I wanted to give you a rundown. One of the things that was mentioned, Fiona Lewis is a physician in the UK who has a ton of expertise in vulvar dermatology. And she talked about a couple of tricks that she used. One is a combination of salicylic acid and betamethasone. So betamethasone is a steroid. Salicylic acid is a medicine that we've traditionally used for things like acne, but it can thin the skin, make it easier for that steroid to get into the skin. So for patients who have thickening and scarring, I think that's one takeaway that I'm going to try if I have patients that have sort of refractory disease. And it comes in a combination, which is really nice. Another thing that was mentioned was acitretin. There was a trial that showed that this acne medicine actually 14 out of 22 patients in the group that got acitretin got better from a lichen sclerosus standpoint, whereas only 6 out of 24 in the placebo group improved. So that means the patients that got the medication on average got better. It's not perfect, right? Obviously, there's still a large number of patients that didn't respond to it, but for that group of patients, that's really tricky to treat. If you are one of those patients, you could ask your clinician about it. And if you're a clinician that has a patient like that, you could think about it. Another thing that was mentioned a couple times is JAK pathway medications. The JAK protein is a protein that starts a cascade of reactions that lead to inflammation in the skin. JAK inhibitors have been used for conditions like psoriasis and eczema. And so JAK inhibitors can help with those skin conditions. And it's thought that they could help with LS because the JAK pathway is involved in the inflammation that causes the itching and scarring in lichen sclerosus. So, there was a trial that happened at our site, an early trial for a JAK inhibitor called ruxolitinib. So we were involved in that trial, but the analysis of that trial is ongoing. So I can't say based on that trial whether it was effective or not, but based on the science, it does seem like a JAK inhibitor pathway would be a reasonable thing to try, particularly in patients who haven't responded to other therapies. Now, again, not FDA approved for that, and it's early, but based on the science, science, it does seem to make sense that it would help. And those medications are expensive, so it's not something to try first line at this point. The other JAK inhibitor that was discussed, a wonderful dermatologist named Margaret Cox from Utah talked about using a medication called upadacitinib, which is another JAK2 inhibitor, or a JAK1 inhibitor, and this is taken orally. So it's a JAK inhibitor, so ideally it will help with inflammation under the skin, and it can be taken as an oral medicine instead of a topical medicine. So that makes sense that for those patients that have really thickened, scarred skin, where you can't get the medication down into the bottom layer of the skin, this may help them. But it has some side effects. It's not for everybody, and it was only a very small case series, a couple of patients. But they did seem to respond well. So it's one of those things that as a patient, if you're not getting better, you could think about asking about. And as a clinician, if you have that patient that's not getting better, another tool in your back pocket. Other things that were discussed and have been discussed for a long time with lichen sclerosus are things like PRP, which is platelet-rich plasma. Basically, you take a sample of a patient's blood, you put it in a centrifuge that spins it, so it separates into different components. And the plasma part has some chemicals in it and cells in it that seem to be able to help with healing. So it can be injected back into the patient. So it's the patient's own plasma that's injected back into the skin. There are the randomized control trials, so the really well-designed trial where some people got no plasma injected and some people got plasma injected, didn't show a benefit of that medication over, just plain old placebo. But some trials that have been done, frankly, in a little bit less rigorous way, did show some benefit for patients. The same is true of laser. There was a randomized control trial of laser for lichen sclerosus. I think in the best designed studies, it didn't show much of a benefit, but there have been some other series that show that it can have some benefit when not compared directly to placebo. But for the patients who are not getting better, these things are things that can be tried. Just keep in mind that they're often expensive therapies. And then the other thing that was discussed is that for kids who are diagnosed with lichen sclerosus, because it can happen at all age ranges, at least 2 years of monitoring is recommended by NASPAG, which is the North American Society for Pediatric and Adolescent Gynecology. But I will say many of the juvenile groups of patients that were followed long term. And it seems like there is a significant benefit to staying on a very small amount of high potency steroid to prevent scarring versus a pretty low risk of using that small amount of drug. So in general, if I see a patient with pediatric lichen sclerosus, I'm going to recommend long-term follow-up for them and generally recommend long-term medication as long as they're tolerating it well and not having side effects. Okay, I think that was a long rundown, but I do think it's important to kind of give you a sense of what's going on and combat some of that misinformation and disinformation that's out there. Please put questions in the comments. I'm happy to chase down answers to questions that you have based on the video, and hope you have a good Monday.